Hello, my name is Allison Warner, and I'm the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about how to best protect your team and your patients amid COVID-19. Today, we're going to talk about the nuts and bolts of employee COVID infections and how the practice should handle them. The reality is more positive tests are likely in the coming weeks and months, and you need to know how to manage that in the orthodontic office. So to talk about this, we have Jackie. Jackie Dorst has been specializing in instrument sterilization and infection control and prevention in the dental setting for more than 20 years. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you again.
Hi, Allison. And as always, thanks to you and to Orthodontic Products for the opportunity to talk to the ortho community and share timely information as all of the information about COVID-19 infections and what we should be doing to mitigate our risk with it keep changing and keep happening. So as we discussed last week, infections continue to rise, and here we are mid-July, so we're looking at schools reopening again in 4 to 6 weeks, and maybe an increased risk there as more of the teachers and the schools are getting out. I'm hearing a lot of that in social media. So there is a lot of new information, and I just want to before we get started, I'd like to do a quick review of the basics of what the ortho office should be sharing with their staff and what they should be reminding patients about, with sort of that as you come in first thing in the morning for the staff, and then as for patients, because I know sometimes we get a little fatigued with seeing all the signs and the recommendations and everything. So first of all, with the staff, if you're sick or if you're running a fever, then stay home. And many ortho offices, they may not work on Friday. They may work, Monday through Thursday. Well, if you're off for 3 days during that time, I would recommend taking your temperature because that helps to identify the time an infection may start, and that could affect either that 10 to 14 days of quarantine or isolation that you need to go through. So one of the first is stay home if you're sick. And remember that every day when you come in, we're going to be screening you, taking your temperature, and asking, do you have any of the signs or symptoms? And please keep those logs, maintain those logs. That's part of your record should you have an infection that may even prevent you having to quarantine the whole orthodontic team or close the office. So you can identify what the risks are. And then wear your mask from the time you come in the back door throughout the day, some sort of mask. Now, the staff that's doing the aerosol generating procedures, then they probably want to wear an N95 mask. If they don't have those available, or maybe the team member can't tolerate them, then that level 2, level 3 mask along with a full face shield for it. In non-patient care times, then if they want to go with a less restrictive, maybe softer, more comfortable mask, then even the cloth mask might be appropriate, or a level 1. We're seeing a lot of skin abrasions along the nose and the cheek with the tighter fitting mask. So that would give them a little bit of a break in there. So, they could have a break from the mask. And when you're reusing the mask, another caution with them is don't contaminate yourself. Be careful about how you take it off. The exterior of the mask is contaminated.
Right.
So if you grasp the front of that mask to take it off, and like the N95, put it in your brown paper bag, or if you're even having to reuse level 3, then you want to either remove the gloves that you were wearing during that time or sanitize your hands. Because if you don't, and then you touch your eyes or your nose, you could recontaminate yourselves. And so, we need to be conscious of that. I know I talked to one of the orthodontists this week, and they were re-emphasizing how all of the team members, as soon as they come into the office in the morning, they're going through the screening, they arrive in their street clothes, and then they change into their scrubs. and wear those throughout the day. And then when they leave at the end of the day, then they change out of their scrubs. And those scrubs in that particular office, they were laundering them in the office. So taking those extra precautions. Now, you know, we're wearing a mask throughout the day, we just talked about, but you can't eat and wear a mask.
Right.
Lunchtime is probably our greatest risk in the ortho office. And lunchtime's a break. That's when we want to sit there and talk and share information about how the morning went or what's in the afternoon, or even our families with it. And talking, singing, laughing, those are all spreads of the aerosol. So in the lunchroom, if your lunchroom is large enough that you can do 6 feet distancing, then please do that for seating. For in the lunchroom. And you might even turn or angle the chairs so you're not looking directly at each other.
Right.
As I'm looking directly at you, and there were studies done of 3 different circumstances in China, in a restaurant, in a call center where all of the call center employees were facing each other, and a bus. And it showed the greatest risk where the infections occurred were, again, that face-to-face. Talking for extended time or laughing for extended time. So if you can turn the chairs, angle them. If you have a really small lunchroom that you don't have a lot of space, then the other alternative may be that you can eat outside, if weather permitting, or eat in your car. You know, sometimes we just need a break from the office. And again, if weather, now the hot temperatures in the Southwest and the Southeast, that probably prevents sitting in your car for your lunchtime. But we can't even go to a lot of restaurants now to eat like we used to. So a lot of people are bringing their own lunch. So a smaller area, if you can't do that social distancing, another alternative would be to stagger lunch schedules. You know, just have 2 or 3 people, whatever you can do to stagger. So you might start at 11:30 to 12, 12:30 to 1, 12 to 12:30, and 12:30 to 1. So stagger those lunch schedules so that you'd have the room with it. So, and then changing from what we need to remind the staff members. So we've talked about, you know, we're going to continue screening, stay home if you're sick, take your temperature, maybe even on off days. And our patients, we need to remind them, come by yourself. You know, as things get more relaxed, it may be that mom decides, oh, she wants to come along and come into the office, you know, with her teenage child or with it. So come by yourself, brush at home. Remind them that your brushing station's closed, brush at home, wait in your car until we call you, because we don't want a lot of people in the reception room, and please wear your own mask from home. You know, again, I know yesterday I had to run an errand, and I actually hopped out of my car to run into a store and left my mask laying on the seat of the chair. And as I got to the door of the store, I went, oh, dang, and had to turn around and go retrieve. So we get on, we're human. We get to thinking about other things. Please, and then ask them to please use the alcohol-based hand rub. After you've gone through the pre-screening and taken their temperature with them. You're going to continue to do that. And then please remind them to call the practice 48 hours after their appointment if they have any signs or symptoms of infection. And I think that's where we've gotten a little bit lax. You know, it may be that a day or 2 that we're seeing the patient until they exhibit signs or symptoms. So reminding them to call us. Now, I did go for my dental appointment. I had a prophy done. And I was real impressed with the way that they did this patient screening, because they had a little piece of paper that we used to call like a buck slip in ortho. And it's where we would write on, before we had computers at the chair, a long time ago, before ortho offices got so digital, it was called a buck slip. And the orthodontic assistant would write on there what treatment was done to the patient, which arch wire size was put in, if the doctor wanted to move a bracket, you know, if the doctor wanted elastic size that was given. And that buck slip was sent to the front desk, where they did have a computer, and the front desk team would enter all of that information. Well, on my prophy appointment, they had a little colored piece of paper about the size of a Post-it note, and my temperature was recorded on there and checked no for all symptoms. that was given to me, and then I had to take that with me to give to my dental hygienist.
Oh, okay.
So that was my pass, if you will. You know how when you go to the airport, you go through TSA and
Right.
they check off on your boarding pass that
Mhm.
you've been cleared by TSA. That was my, Jackie's cleared and she's safe to see. Then it was given back to me at the end of the appointment. So my dental hygienist could see that, yes, her temperature is acceptable. And then I had to take that when I checked out, and it was turned in at the end of the appointment. So all of that information is logged into the computer.
Okay.
Again, it's important for the ortho information, for the orthodontic office to have this on patients in case they do have an infection.
Right.
Do you have that documentation in your computer file? Can you retrieve it that, yes, we did take that patient? Because when you get a lot of ortho patients coming in, and as the schedule gets busier, could somebody slip through? You know,
Right.
could they fall through the cracks, as we say, and they didn't get their temperature taken? So
Mhm.
some way that we're going to document all of that. So that's updating, you know, on where we need to be
Right.
with the basics for both
Mhm.
patients and for staff.
Okay. Well, that's a good review. So now let's talk about what should practices be communicating to both staff and patients if they test positive?
Oh, that's the scary moment. You
Right.
go for a COVID-19 test and it comes back positive. What do we do? What do we do? Or a patient calls you and says, oh, my COVID test that I took last week, because there's some delays in tests
Yeah,
coming
that's a big
back, you know,
issue. Yeah.
4 to 5 days, a week, I'm hearing even in some. So
Yeah.
they may call and say, we had no idea, but our test came back and we tested positive. So for that, we're going to go back to the ADA toolkit.
Mhm.
Remember, we've talked about that several times, and there are documents in there. So the ADA toolkit has a document on what to do if a patient tests positive, and then they also have another page on what to do if a staff member tests positive on it, and it actually gives you a triage in there.
Mhm.
And what they want if a staff member tests positive with it is you need to have some sort of organized way to investigate it.
Okay.
And you may not have put that in. CDC has provided one for all of healthcare settings. So it's a little bit slanted toward medical, but I
Mhm.
highly recommend that they go ahead and download it. And hopefully we can give them a link in our video interview. And this is what the document looks like.
Mhm.
So it's a risk assessment, and you can see how it has a place on it for both the employee's name and what is their healthcare worker information, and
Mhm.
was it a community exposure, and then when you go to the second page, or was it a professional exposure? And
Mhm.
it gives you a list of questions to ask about, did you have a direct skin to skin contact? Or was
Okay.
it an aerosol contact? How
Mhm.
long were you in contact with this person? Where were you wearing PPE during
Mhm.
this contact? Because the defining moments of exposure are from CDC. If you're with somebody for, say, more than 15 minutes
Mhm.
and you're not wearing a mask, and maybe you're within that 6 foot range, that social isolation that we should be doing,
Mhm.
then that's considered a risk.
Okay.
That's defined as definitely. If you're outside of that 6 foot area, social
Mm.
distancing, and you were wearing your mask, then there isn't a risk.
Okay.
So this gives a triage of how to assess that exposure incident and give you documentation.
Mhm.
Then the next thing is, from this assessment, you have to determine, do we need to quarantine the
Mhm.
employee from
Right.
that was exposed to this patient? Do we need, and hopefully the whole team was wearing their mask, so you don't have
Mhm.
to quarantine the whole team, because
Mhm.
that was part of your protocol to prevent these exposures.
Right.
So it gets complicated. Now, the ADA toolkit, to help put it all together, did put out a COVID-19 risk assessment, and that's available on the ADA website.
Okay.
So I would encourage team members to go down to action item 4 on it, and that's a conduct an incident investigation of an exposure. And it even gives them the list to this risk assessment that we just looked at.
Okay.
Now, as I've mentioned before, I'm on the AAO COVID-19 Task Force. And at our meeting that we had with CDC on this last Monday, and afterwards, that was one of the big topics that orthodontists, CDC wanted to know what's the big challenges for the AAO now, for the AAO membership, and having a template, if you will, for an exposure incident for employees or staff was one of the challenges, and having all that information in one place. So the task force is going to be working on putting together a simple kit, if you will, a file folder that you can download, and hopefully we'll have that on the AAO COVID-19 website, and that's a great resource for the members. There's upgoing and continuing information added to that.
Right, that's great. I want to go back a little bit. You talked about like once a employee tests positive, but because of that testing lag, if an employee goes in for a test or a patient goes into a test, are they supposed to be quarantining while they wait for those results? Because if those results are taking a week,
well, you're going to have to, again, it's going to be a case-by-case assessment.
Okay.
And when you're looking at it for an employee, was it a high-risk exposure, say without a mask, or a low-risk exposure? If it's a low-risk exposure, the employee can continue to work, and you would just take temperature and monitor every day. If it's a high-risk exposure, yes, then it would be wise to go ahead and start quarantine until the laboratory test information is back.
Okay. So potentially you could be starting that checklist, the CDC assessment, if it's a high risk, if you think it's a high risk exposure at that. Yes. Walking into that at the time they're walking into that test. Okay.
Yes, and ideally, I think what would be good is this help the employee staff risk assessment. If we could come down after asking all the questions and determine high risk exposure, low risk exposure, and almost like an algorithm of and then this is the action that you've taken. I would hope that in the near future that's something that CDC could provide. They put ortho and dental, the whole dental community, and what they call the oral health division of CDC. And in speaking with Dr. Michelle Neuberger and several of the CDC team members, this is something that's high on their priority list.
Right, definitely. Well, a lot of this information gets really complicated and confusing, so I appreciate us focusing in on this. Are there any other resources out there that orthodontists should know about, or staff?
There is. I'm very happy to tell you that this week it was scheduled, the AAO is scheduling a live town hall meeting on July the 28th. I believe that's on a Tuesday. It is going to be in the evening at 8 p.m. So doctors, practice administrators, even team members can sign into this, and they are going to have experts from each area of the practice that's affected by the COVID-19. So I'll be on there looking at the infection control part and the staff protection with it. Dr. Mike Durbin, who's been head of the COVID-19 task force, will be on that call also on the town hall. It'll be led by the president of the AAO, Dr. Chris Roberts, with it. And then also Dan Wicker from Kane Waters is going to provide the financial information. How's the COVID-19, the closures and the reopening affecting the orthodontic office. And then we'll also have Paul Edwards from CEDAR, which is the AAO's HR expert on there to answer. So we'll be talking about the infection control, financial implications, and the HR, and what the AAO is providing for member resources on it. So I think it's going to be a heavily attended. Everybody mark your calendars. Tuesday, July the 28th at 8 p.m. And we'll have this town hall that will provide live answers for the complex questions. Because it does get confusing.
Definitely. Well, thank you again, Jackie. I think this is very valuable right now. So we will be back next week for another episode of In the Sterilization Room with Jackie Dorst. In the meantime, to keep up with the latest orthodontic industry news and to check out past episodes of In the Sterilization Room, please visit orthodonticproductsonline.com. Until next time, take care and stay safe.